Hey, so today in today's short video, we're going to discuss vitamin B12 and why, even if you take a supplement, it may not be enough. Hi, my name is Michelle Clay, and I'm a family nurse practitioner, and I help patients lose weight and optimize their health and well being. Okay, so vitamin B is also known as cobalamin. It is a water soluble vitamin, and it's involved in several body functions that are key for overall health and well being. These include the ability for your body to convert energy, also for a robust nervous system. It also is important to the synthesis of DNA and RNA, and it also takes the lead in the production of our red blood cells. And then, of course, red blood cells are the cells that carry oxygen throughout our body, so super important. And nearly 40% of Americans have inadequate B12 levels, and even more have adequate but not optimal levels. So, what are the signs and symptoms that you might be on the lookout for that may indicate a B12 deficiency? Well, fatigue and weakness are very common. This would be persistent tiredness that doesn't improve with sleep, pale or jaundiced skin, numbness or tingling, especially in the extremities. So, fingers and toes, especially. Balance issues, and this could manifest as, difficulty walking or unexplained coordination problems. Cognitive changes, brain fog, mental lapses, mood swings like depression or anxiety, and then anemia, in particular, an anemia that's caused by a reduction in the number of the red blood cells. Okay, so there's two common reasons that you could have a B12 deficiency even if you're taking a supplement. So, for one, B12 is, and there's a lot of supplements like this, vitamins and supplements that need buddies in order to be absorbed well by the body, and B12 is one of those. So, if you just take it by itself, it has limited abilities to be absorbed. So, for this one in particular, it's better if you take like a B complex, and that way you have all the different B varieties, and that will help your body absorb the B12. It will help improve all of the absorption, but in particular the B12. So, that's one common reason. Another common reason is that there is a very common gene mutation. It's called the MTHFR mutation, and about 50% of people happen to have this. And if you're one of those people and you have that variant, then it's impossible for your body to convert cobalamin into the active usable form. And cobalamin is the most common B12 supplement, that's added to foods and that's found in supplements. So because of that, you could be taking a supplement and not having results, not having improvement in your level. This could be a very big reason why. So, since most of us don't have our genes mapped out to know whether we have this gene or not, it's better to just assume we do and take a form that our body can convert, regardless of whether we have this genetic variant or not. Okay, so the only way to really know what your level is of your B12 is to have a blood test. Now, this is not one that's normally checked by your provider. It's not a normal annual lab value, for instance. So, if you are concerned, you have several of those symptoms we talked about earlier that make you think you may have a deficiency, then you may need to ask your provider if they could check it for you. So, normal test ranges are 2 to 300. And ideally, though, it really should, for optimal health and well being, it should be around 700. So, if your result comes back and it's normal, but you still feel like you have some of those symptoms, then you may want to see a functional provider to kind of dig into that a little bit deeper because you may still be below optimal levels for you. Now, for supplementation tips, I do recommend if you need one that you consider taking a complex that includes several of the B vitamins, not just B12, but all of them. It's also recommended to take it in the morning. And then, in case you have that genetic variant, you'll want to look for methylcobalamin or hydroxycobalamin. And both of those your body can convert whether you have that gene mutation or not. Okay? I hope that's helpful. And if you have any questions, please reach out to me.